Hello and welcome to episode 7 of the Wor Wellbeing podcast. I'm joined today by Nicola Beckett, who is from the tobacco dependency team, and we're just going to have a little chat about her service and all the lovely things that it offers to staff and patients in the trust. So hi Nicky.
Hi Sarah.
Are you okay?
I am, yes.
Don't be nervous.
Thank you for having us.
It's lovely to have you on. So can we just start off with you telling me a little bit about your background and how you've ended up in your current role?
So my background is midwifery. I'm a midwife and I have over 10 years clinical experience as a midwife.
Okay.
That's as a rotational midwife around the hospital and in community. I spent a little bit of time in Northumbria University working in the competency test centre, so that involved supporting international nurses and midwives who wanted to gain that NMC pin to work in the UK.
Right.
And I think what brought us to this role was probably my passion around the NHS, protecting the NHS. You know, it's a wonderful thing. It should be protected and we should be supporting it. And that includes, you know, improving patient care, reducing the demand on the NHS. Yeah. And I feel this role, the public health prevention side of it, is something that really attracted us to the role.
Fantastic. So, brilliant. So what is the structure of your team like? Kind of, what does it look like?
So in my team, I am the health improvement specialist. Mm-hmm. So I'm responsible for managing 2 teams. I've got the tobacco dependency advisors, and I've also got the Best Start in Life team as well. They look after the pregnant women. So these teams are in addition to smoking cessation that's offered in the community.
Right.
They're not to replace it, they're in addition to it.
Okay.
So both teams, the tobacco dependency team look after the patients in hospital. Like I said, the Best Start in Life look after the pregnant women. So both teams are looking at the patient holistically. They're taking into consideration the social determinants of health to support them around making a successful quit attempt. I'll give you a little overview of both teams. So the tobacco dependency teams look after the inpatients. So every person that comes into hospital, they're ensuring that they've got the nicotine replacement therapy. Mm-hmm. They're offering behavioural support, and they also offer referral on discharge to the community setting. They give follow-up to the patients. So once patients are discharged, they'll contact them via telephone, give them a telephone call at 7 days and 4 weeks, just to see how it's going. That's around brilliant. The smoking, So when we talk about the social determinants of health, you know, you're speaking with these patients, and if somebody is in a situation where they're actually homeless at present, you know, you saying, are you ready to give up smoking?
It's the least of their problems.
It's not really their priority. So the girls can signpost them to where they need to be to offer support in that area of their life as well. So it's not just around the tobacco
dependence. It's a wider approach. It's brilliant.
A holistic approach towards the patient. The Best Start in Life team, again, they're responsible for looking after the pregnant women. They give extra appointments throughout the patient's pregnancy. Mm-hmm. And again, they can signpost women. They do all sorts of things with them. They organise bump and buggy walks.
Oh, right.
There's a social aspect of it, you know, people who might not have a good friendship network, family around them, you know, there's that social side of it. They offer emotional support, again, signposting to financial support. You can discuss vaccines, help with housing, signing up to the family hub in infant feeding. I think between the 2 teams, they're absolutely pivotal to healthcare professionals, nurses, midwives, and supporting them, you know, for the patient's journey. It's just that little bit of added care that they're giving the patients.
They're doing so much more than helping them with their tobacco dependency.
And I know personally, me as a midwife at the time when I worked in practice, I think I would have been absolutely grabbing that with both hands and taking it on board.
Yeah, brilliant. So this might sound like a silly question. It seemed silly when I wrote it down, but why is helping people to stop smoking still such an important focus for the NHS, and is smoking still as prevalent as it always was when all those adverts were on the TV back in the day?
It's not a stupid question at all. It's, you know, it's an important part of it. The NHS long-term plan stipulates that we must support smoke as well. They're in more care. We know that stopping smoking is the greatest, biggest thing that we can encourage our patients to do. Better outcomes for the patient, better outcomes for the NHS. It reduces readmissions, bed take-ups. Tackling prevention such as smoking can help people live longer, improve their own care. Smoking is the leading cause of preventable deaths and diseases in the UK, and we know that it can harm and kill up to 2 in 3 people.
Still, I mean, it just, you would think with all of these things that have been put in place, I mean, I was just seeing in the news last week that they're now going to make it that you can only smoke in certain areas, even outside, but it's still obviously really kind of embedded in our culture.
It's changing the culture and how we look at it. That's the most important part, you know, reducing the demand on the NHS if we can support smokers. You know, smokers are a third more likely to see their GP than non-smokers. Nearly 500,000 hospital admissions are linked to people that smoke. It harms every organ in the body. It causes several forms of cancer, COPD, you know, heart disease, strokes, you know, and when we talk about the prevalence, there's still 6.1 million people smoking in England.
Wow.
Looking at the North East alone, you know, yes, the rates are coming down. So in 2005, the rates were 29%. In 2022, they were 13.1%.
Oh, that's massive then.
They're coming down, but we've still got a bit of work to do. You know, just in the North-East, 270,000 people are still smoking. You know, that the evidence shows that it is killing every 2 in 3 smokers. The ambition is to make England smoke-free by 2030, having a prevalence of 5% or less. So
really?
If you think
about it. Is that
about
achievable, do you think?
It's going to be,
It's going to be. Nicky's going to do it.
I'm on a mission. I mean, in the North-East, the Northumberland rates are 9.6%, North Tyneside 11.2%.
So it's getting...
We're reducing, we're just, like you say, it's the culture and it's getting the messages out, you know.
So I wanted to ask you about vaping. Maybe I'm kind of naive on this, but I thought that smoking had really reduced because people were vaping, but now it seems to be that a lot of teenagers are starting vaping when they necessarily wouldn't have started smoking. So do you have a lot of people reaching out now for support, not only to stop smoking, but to support them stopping vaping?
So just to be clear, when we're talking about the Tobacco Dependency Service recommending vapes, we're talking about adults over the age of 18 that are using vapes as a short-term method to help them successfully quit. Vapes don't produce the tar or the carbon monoxide that cigarettes do. We know that nicotine vapes are 95% safer than smoking cigarettes. And we also know that vaping is not completely harmless. And we are only going to recommend it for people to use it as a method to quit rather than replacing one with the other. You know, almost 2/3 of people who vape with support from the local authorities, stop smoking services, they're more likely to result in a successful quit attempt.
All right, so in that kind of way you can kind of see.
When we talk about them, you know, quitting vaping, you know, we ask to do it when you're ready, when you feel that, you know, if you quit vaping, it isn't going to lead you back onto cigarettes, and your smoking services, you know, your local authorities are there to support you with this as well. I think one of the common myths as well is, which I hear lots of all of the time, is, but vaping causes popcorn lung. That is
I've heard that one.
Myth. It's basically the disease was found in a group of factory workers that were exposed to a chemical used to flavour popcorn. It was called diacetyl. So diacetyl is in cigarettes, but it's banned in the use of vapes. So it's about getting your vapes from a reputable source, you know, your local stop smoking services, that we know what's in them.
So for any of our staff who are listening, who are thinking, you know, it's time. I know it's not January, but you can start in whatever month of the year, can't you?
It is,
it doesn't matter what day it is, you can make that choice. If they're thinking, I'd really like to tackle my tobacco dependency, what support's available and how do they kind of find out about it?
So for NHS staff, depending on which area you live in, obviously there's 2 local authorities. You've got Northumberland and you've got North Tyneside as well. Both offer a very, very good service. The only difference with the 2 is North Tyneside is pharmacy based, so their smoking advisors are based in the pharmacies. Northumberland have that stop smoking service with their advisors separately. So it's a 12-week program with one-to-one behavioural support. Included within that program, you have your nicotine replacement therapy. So you've got patches, you've got gum, lozenges, your mouth sprays, you've got quick tabs, and you've got medication that obviously needs to be prescribed from a GP. And they also offer a swap to stop vape offer. So basically, it's exactly what it sounds like it is. You're swapping your cigarettes for vape. You're given the vape, you're given the liquid, and all of the medications are free to use as well.
Oh, that's amazing.
It's available for
all staff.
All staff to take up. Yeah,
brilliant.
You can self-refer through the local authority, and you can do that. I can attach the links to the. I'm saying I can. You can.
The wonderful comms team will be able to put some links for us, I'm sure.
So they can attach the links for both for the North Tyneside and Northumberland area.
Brilliant.
The staff can just refer themselves.
Yeah, and do you get lots and lots of self-referrals coming through that? Is it something that's really popular?
We haven't really looked at the staff referrals at the moment, and that would be through the local authorities that I would need to be going through. But
I will to know,
I will be looking
kind
at
of,
that part, because
how,
it's interesting to see who's taking it up. And,
who's taking it up and how successful they are in stopping smoking. Brilliant. We're very lucky to have that all as part of the offer for staff. So if staff come into contact, even if they don't smoke, if they come into contact with patients who smoke and they're really, really keen to end that addiction, where's the best place for them to signpost and support those patients?
So when staff, it's a case of when staff come into contact with them, because, it's about that making every contact count approach. Patients now expect to be asked about their smoking when they come into hospital, and it's a pivotal time to be approaching, because they're thinking about their health, they're thinking about, what they've came in with, and you're probably going to catch them at a time when they're thinking, I really need to stop this. Yeah,
they're a bit more open to having the conversation.
Yeah. And it's not a difficult conversation like it once was, because people know they're going to be asked about it. So it's about using very brief advice, which takes around 30 seconds. Going under the ask, advise, and act. It's just something as simple as do you smoke? And then you're recording the patient's smoking status on Nerve Centre. It then automatically refers them to the tobacco dependency service once you've done that.
Oh, right. So they don't have to actually ask?
They don't have to do everything. All they've got to do is ask, do you smoke? And every patient should be asked if they smoke when they come in.
I was at an appointment of my own yesterday, and I was asked that. I think it was date of birth, first line of address, do I smoke?
That's good.
But I didn't realise that if I don't smoke, but if I'd answered yes. that automatically takes you to that offer.
It depends if you're in hospital. So that would be as an inpatient.
As an inpatient, I'm with you.
So once you've asked and you've worked out your patient's smoking status, advise, when we say advise, we're not asking staff to be smoking cessation advisors. We're asking, again, very brief, do you know that the best way of stopping smoking is with a combination of specialist support and medication, nicotine replacement therapy, or e-cigarettes, depending on the patient's response, because you have to respect that some patients they don't want the help, depending on their response. If they say yes, then we are asking staff in the hospital to give the patient the NRT within 2 hours.
The NRT
is the nicotine replacement therapy.
Okay.
We're asking that they be given it in 2 hours. Once they've been given that, they then will be automatically seen by a tobacco dependency advisor who will come and see them within the first 24 hours of them being in hospital.
Brilliant.
So what the girls can then do is, speak to the patients. Is the NRT working well for them? Do they need to be changed to something else? And then get the patients thinking about, quit dates, what works best for them, things like that. Again, depending on what area you're in as well. If you're in community, you can use the links, you can signpost the patients towards the area that they live in, or they can refer them on ICE to the stop smoking services. The community midwives, once they fill in the Badgernet system.
Don't know about that, but
so Badgernet is a system that the midwives use. So once they fill that in, that'll automatically refer them to
Right.
the Best Start in Life team as well.
Right, okay, brilliant. So there's loads and loads of kind of places that staff can signpost patients or just people who they meet in the community. If staff, just in case we didn't kind of cover that, if staff want to refer themselves, where do they go on the portal? Where would they find you on the portal?
It would be under the public health portal.
Under the public
So if
health
they go,
portal.
and again, same for staff, if they've got any, concerns, if they've got any questions, or they just feel like they're not quite getting what they need to be doing in terms of, administering the nicotine replacement therapy,
Yeah.
because that is done through the portal, through e-records, sorry.
Okay.
There's a protocol on e-record that it talks them through
They can
prescribing
follow.
the nicotine
Yeah.
replacement therapy. Yeah, if they need support with that, they can go through the smoke-free website. I'm more than happy to come round, or they see on the wards,
Yeah.
they see myself or the TDAs
Yeah.
on the wards. Just
Yeah.
give us a shout and I can come and support them with anything they need help with.
Fantastic, that's brilliant. Well, got to the final question. We've made it to the final question, Nikki, and it's all about you. Ask this to everybody who comes on the podcast. What do you do to enhance your own well-being?
I'm not going to mention my dog because he is he is
Everybody
not,
mentions their dogs.
Well, I'm
it's
not going to
fine.
mention him because he's not a stress-free animal. I like walking, so I like being out in the hills and fell walking, things like that.
Lovely. In all weathers, or are you a fair weather walker?
No, I like a bit of. I probably prefer the October months, the autumn months,
Yeah.
to be honest with you, because it's a bit cooler
Yeah.
and nothing worse walking in the heat. And I think when you talk about mental health and things like that, the best thing I love doing on my way to work is turning the radio up and singing.
Yes.
Sing like nobody's watching.
Sing like nobody's listening as well.
Well, I hope they're not.
I'm the same. I love a bit of a sing to the radio. Oh, that's brilliant. I'm glad I'm not the only one. Thank you so much for coming on and having a chat and letting us know all about the service and what it offers. And thank you everybody for listening. Please make sure that you subscribe if you don't want to miss any future episodes.